Great. So this is very open to questions. I think last time there was a request just to give like top of my news, what's going on in the community. Um, Given everything that's going on with the change in administration at the federal level, there has been sort of a little bit of a jilt in for the community. And with that said, I just wanted you all to know that for anyone who is wary of what's happening at the federal level, just letting you know that not everything is completely changed. There's a lot of things that are still running. I did check in. I wanted to talk about this, but I wanted to talk about it without speculation. I wanted to just tell you what others are telling me. So essentially, I did reach out to folks who are currently at the federal level from HRSA, Human Resources Service Administration, the CDC, and FEMA. And look, they're all colleagues who got jobs using what I teach. And they let me know that currently at their job, there's no significant changes. They are in general concerned, but they still have their jobs. Those that are sort of through our community seated at the federal level. That's the best way I can explain it. But yeah, so essentially they're still good. They are anticipating changes, but no one is quote unquote losing their job from where they're sitting. Beyond that, what's happening is there is like hiring freezes and people's jobs being rescinded or job offers. So if you're in that space, I don't know if any of you are, but just so that you're aware, it seems like there's just a big pause in any new employees, any changes. Um, it's just changes or a no right now. So that doesn't mean you shouldn't apply to federal jobs. I think it's more of your comfort level, what you're really shooting for. Obviously, they're still going to need staff for various administrative reasons, right? I just think I've been talking to mentees who, with my mentorship, when I got to talk to them one-on-one, most of my touch bases this last week was this. They were just like, what do we do? Like, what now? Like, do I stay away from federal job applications? Do I stay away from all government applications? Right? So I would say it's kind of up to you. But just be patient with the changes. That's kind of that's all I know right now in these first few days. I wanted to at least give you a little bit of hope that those who are, currently in the administration haven't seen too much yet. They're just kind of waiting to get, but to be told if anything changes. Questions on just all of that?
Hi, Zoila, it's Allison.
Yes. Hi.
So the one, the executive order that came down, I guess late yesterday, last night, depending, I guess, on what side of the coast you're on, with a pause of grants, loans, and other financial assistance. I anticipate how that's going to how that is going to impact, of course, everything, all work. But do you have any thoughts or anything you can share that you've seen about how that will or could impact kind of the down the line? I think about it in terms of my own experience that even if I haven't worked, I have never worked for the federal government or directly for the state government. Health agencies but I've always worked with them and always worked under some kind of funding that has filtered through multiple levels. And so that's where I see the potential for a lot to happen. I'll just put it that way.
Okay, so I want to follow. So there's just so much on a daily basis. So you're referring to which executive order again?
The pause of grants, loans, and other financial assistance.
Okay. So I think that is more, okay, so in general, when there are changes, there tends to be a pause on stuff. That doesn't mean it's gonna go away. So there's that. So as far as like any pause you hear on grants, that doesn't mean they won't be repackaged, right? Like there's sometimes that happens where they're like, well, there's this X amount of money not spent. Let's repurpose it for something else, right? That is more in line with what the administration would want. So as far as how that impacts the work that trickles down, I think it just depends on your focus area, like what it is that the grants, are being cut. I know, for example, I did get questions about, we're at the local county, for example, and we just got federal funds from, say, CMS. I think that was the question is she works under CMS, but at the local county, she's like, we just got our funding, like our new funding agreed on, and we're just going to keep moving. She's like, we assume any changes will take a while to kind of trickle down. And I don't know if she's right. Like maybe, like, I don't know exactly what she's doing at the CMS level, but I'm just letting you know, I think it really depends on if things are considered grants versus tax allocations, right? So I wanted to remind you all also on that same note is there's only so much that the federal level there's only so much that they at the federal level can really shake up. So as an example, I think about my work I had done at the California Department of Public Health, where our funding was under tax propositions that were through tax sales of cigarettes in California. And that was like Prop 99 and other propositions that have passed over the years that we as taxpayers in California have said, yes, let's raise the taxes or put a tax on something, and then that money is allocated and sent back into community. That is California. That is our money in California to manage. Yes, we work with federal, like I remember when I used to work there, my title was health program specialist. And I loved it because we also did get to work with CDC and certain money. So maybe those projects will be taken from the portfolio of work for the California Department of Public Health. Specifically, I was at the tobacco control program, but I'm using it as an example where like, government, even at the state level, is managing different pots of money. And if it happens to be federal funds, yes, it's unfortunate that'll go away, but that doesn't mean it's just like all their work is undone, right? Does that kind of help with understanding the shifts happening too?
Yes, thank you.
Allison, good. Okay.
It's helpful to hear from others, especially like versus what I read, because there's so much that is flooding. Um, and even the stuff that I usually rely on, it's just hard to decipher. It's hard to figure out what's,
Because we don't want to, I hear you, Allison. I
yeah.
don't want to feed into speculation. I promise myself that when we talk about this over office hours, I'm not going to like raise any of my concerns or what I think might happen or what happened last time will happen again. Like all of this, what if, what if, what if? Sure, the first 100 days is about to be rocky. We can kind of just know that, right? But I think I'm getting a lot of messages from all of you who are like, should I look for another career? Like, is public health done for? Do I need to? Some of our community members are on it and they're like, they have their bachelor's and they want to get their master's. So they're just kind of waiting for the right time. They're like, should I pivot? Should I like not go to school? Like this is impacting a lot of people's just overall career decisions, right? So I get it. We're here for office hours through the hired community, really trying to get those jobs, but it is trickling down on all our other decisions on how to position ourselves, leaving certain focus areas. Another common question I'm getting, would love to hear your questions as well, is like the focus areas. Like, oh, I've been doing maternal and child health for the last 5 to 10 years. Should I pivot? I think that's a personal choice. I think it depends on the scope of work you're doing. It depends on, how well you know the industry. I mean, I'm not giving up on folks who want to keep doing that in the mentorship if they're like, no, I still want to. They're still out there. Keep in mind, healthcare. Here's another example. Healthcare companies are still very vested in the community's health. They're vested in their employees' health, right? Employee health and wellness is still going to be going on. So for example, if you are in community education, you have your CHES, you've never thought of employee wellness, employee health, that's a space you can try to pivot into. That's very private sector, consulting, healthcare-based kind of work. But, I think it's just being aware and mindful of where are the other industries that are offering opportunities that are vested in community, that really want to give in ways that are about prevention and wellness. So healthcare is another space. I know yesterday I spent some time with a mentee on that. We found some healthcare options for her. Questions from all of you. This is a great group. There's a few of us. Keep introducing yourself in the chat. You're welcome to drop a LinkedIn profile link, your little URL.